helping save lives. To help us with our mission, we use the Utstein formula of survival as one of our guiding principles. The formula consists of three component parts: medical science, educational efficiency, and local implementation. Laerdal have contributed to medical science in various ways since the launch of Resocian in 1960. An example of this could be our recently introduced QCPR technology.
The Nursing and Midwifery Council have recognised the importance of simulation, and in 2006 they ran a pilot study allowing universities like ourselves to use some of the hours that students would have been in their hospital placements or in the community, but in using simulation instead. And that was overwhelmingly successful. Students absolutely loved it, learned a huge amount. And the result of that was that the NMC in 2007 released a circular allowing universities to use up to 300 of the 2,300 hours that students have to do over 3 years in simulation, which I think is a real testament to the value of simulation, and they've recognised that. Nursing is and has always been a very practical profession. When you're sick, feeling vulnerable, you want somebody who is a competent person, and it's quite difficult to learn some of those skills on real people because they're invasive skills, and of course it matters that we get it right first time. It is common sense that simulation must play a big part. If you want good quality nurses, we've got to give them good quality training, and that starts, for me, with good quality simulation.
That's right.
In the ambulance service, we've always tended to use some form of simulation, relatively low definition. But more recently, it's become very central to how we prepare our paramedics, our technicians, our ambulance crews generally, for the world of work and the real challenges which they'll face in the field. The use of modern simulation technology is now enabling us to fuse the benefits of crew resource management, non-technical skills type training with the clinical skills type training, which we've always done in the past, but not necessarily in the same way. It's a really powerful and synergistic relationship, and we're seeing the benefits in terms of student response and in terms of patient care.
It's now been recognised that there's a huge importance in simulation as an educational training methodology. Within healthcare, within the United provides us with that technology, allows us to put ourselves into a position where we can train multi-professional healthcare teams to rehearse real-life situations, so should they happen, they are adequately prepared to prevent error and reduce harm to patients. One of the most rewarding things we find about utilising simulation to deliver